The federal government has authorized the extension of a nationwide lockdown for 4 weeks as the country continues its fight against the COVID-19 pandemic. The latest extension is the third for the second phase of an eased lockdown, and Chairman, Presidential Task Force on COVID-19, Boss Mustafa says this follows President Buhari's approval of the sixth interim reports and recommendations of the task force.
The Presidential Task Force reached the conclusion that for Nigeria, it is important to ensure that restrictions are not completely relaxed in order to control and abate further community transmission.
Over the past few months, the PTF continuously relies on the use of science, data, and adaptation of global best practices to drive a national response to COVID-19. Consequently, the current phase of the response introduced slight modifications or geared towards addressing economic, socio-political, and health concerns to drive an effective public health response against COVID-19. So what about these updated implementation guidelines for extension of another 4 weeks lockdown? That's what we're looking at on this edition of a program. It's Nigeria Today, reaching you live on NTA News 24, broadcasting to you from Nigeria's capital city, Abuja. My name is Musbat and Wahal. Thanks a lot for joining me. In a moment, you meet my guest. Right, I have two gentlemen, very important in the fight against COVID-19 in Nigeria. First, national level, and the other at the FCT level. Joining us in the studio is the National Coordinator, Presidential Task Force on COVID-19, Dr. Sani Aliyu. Thanks a lot for joining us, Doctor.
Thank you for having me, Ms. Powell.
Also with me in the studio is the Chairman, FCT Ministerial Task Force on COVID-19 Enforcement at Iharo. Thanks for joining us.
A wonderful evening, Musabao, and I'm nice and I'm happy to be around.
It's our pleasure to have you always. Now, let me start with the National Coordinator, Dr. Aliyu. The measures put in place for the current phase 2 of the eased lockdown is being maintained with adjustments. What are these modifications you have?
So you're right in that we've maintained phase 2, but what we've also done is to look at those particular parts of our normal day-to-day work that do not pose a significant risk when it comes to recrudescence or relapse of the COVID pandemic in Nigeria. So, for instance, we've looked at the grade levels for civil servants resuming work, and just to clarify, we are now allowing people from grade level 12 and above to resume, not grade level 1 to 12 as I've just seen in one of the newspapers today. So only grade levels 12 and above, and even in those cases we're really encouraging people that are essential to the service, essential workers, to resume. We are also continuing to discourage government officials from traveling unnecessarily or from meeting physically. If you can have your meeting virtually, it's much better. We certainly would not encourage any physical board meetings, for instance, or oversight visits to areas all over the country where people tend to congregate. All these are discouraged strongly because we know that the pandemic is not over yet. As you know, we've opened up the domestic travel in terms of air travel. We've also allowed rail travel with the usual precautions that we apply. We've decided to maintain the curfew hours of 10 p.m. to 4 a.m. Partly because we continue to be very concerned about the risk of people going out partying, especially in the night, especially over the weekends, and ending up increasing the risk of transmission. We continue to encourage those that are vulnerable, so those above the age of 60, those with diabetes and other comorbidities, to please stay at home, because it's still safer for you to stay at home than to engage in mass gatherings or activities. The restrictions that we have for mass gatherings, places of worship, etc., remain with all the usual caveat that we've applied. And the thing for the public to remember is it's always better if you are meeting as a group preferably not more than 20 persons, and preferably meet outdoors, because outdoors your risk of catching COVID is much less than if you are indoors and you're not wearing a mask. We'll continue to work very closely with the law enforcement agents to enforce the use of face masks. And this time around we will insist, certainly when it comes to public buildings and when it comes to public services and even private buildings that serve public purposes, so for instance shops, etc. If you are not wearing a mask, you should not be allowed access, and if you are not wearing a mask, you should not be serviced. If you're going for a particular service, you should not be served. We have also allowed certain activities. So as I mentioned, outdoors, for instance, we are allowing non-contact sports that's outdoors. So examples of this include tennis, lawn tennis, table tennis, squash, that's outdoors, polo, golf, for those that might be involved in such sports. And there's a full list that will be made available by the Federal Ministry of Youth and Sports. But I think overall these are really the main adjustments that we have made. We've decided to keep the restaurants closed except for takeaways, bars, cinemas, gyms, all those activities that relate to social interaction, close social interaction, remain restricted. Schools, we are allowing final year secondary school students, as you know, to resume and take their exams and then exit. The rest of the schools remain closed until this pandemic, until we've reached a stage where we feel that it is safe enough. With international travel, we are really working very hard with the aviation authorities. The main reason why we are delaying opening up straight away is because we need to put in place infrastructure that would allow for some sort of investigation or sampling of passengers as they arrive from abroad, because we've realized following the evacuation of Nigerians, we had up to 10% of Nigerians coming in, even though they had a negative PCR test for COVID. When we tested, they ended up being positive. So we want to be absolutely sure that it is safe for us to open our borders. It is
safe to continue to have all of this. It's good to have these modifications like we're having it. It brings relief. And let me pick from your words. You said the pandemic is not over yet. But in the last few days, the statistics we've been having from the NCDC show that we're having a reduction in number of cases oscillating between 300 and 400 in the country. Now, are you saying with this reduction, we can now be relieved that we're not going to have a second wave that has been much talked about?
So to be honest, we haven't even, we're still in the first wave. We're still cresting on the first wave. I think it's far too early to even talk about second wave, because we haven't seen a consistent fall in the trend. Yes, the number of positives have reduced, but this is for a mixture of reasons. So for instance, we are still not testing enough. Our capacity, even though we've increased the number of labs from 34 to 61 labs covering 31 states, and we've improved our capacity. We can now test up to 10,000 samples a day, but we are only yesterday we tested only about 3,500. So that demand is just not there. We are not testing enough to really give us a very good idea of the trend. Have we plateaued or not? But having said that, we know from the positivity rate in the past, when we test 100, we will get 20 something positive. But now when we test 100, we get about 10 positive. The positivity rate is about 10%. So that in itself is a good sign that A, we are testing a lot more, and B, hopefully we are starting to reach that sort of plateau. But I must warn the public that this is far from over. The number of positives strongly reflects the number of samples we test. And during the Salah period, which you would expect, there was a lull in the number of samples coming in, and that partly explained why the numbers suddenly went down. And with pandemics, you don't have a situation where today you're having 600, 700, and then suddenly it drops. It doesn't happen like that. It's usually a gradual fall in the numbers. So I would urge the public to continue to observe all those protocols that we advise on. Exactly. So the use of face masks in particular is really important. Making sure that you sanitize your hands at all times, especially if you go out or you touch surfaces that might be contaminated. Keeping a physical distance, because if you maintain a physical distance of 2 meters or more between you and somebody who's coughing, like Musbah over here, we're maintaining more than 2 meters distance. Even if you cough, even if you have COVID, and I'm not wishing that you have COVID, I'm not going to be too worried, because by the time the droplets will not be able to reach me. They will settle before they reach me.
Very well, exactly. Yeah. People still need to do a lot in that regard. And now let me quickly come to the Chairman, FCT Ministerial Task Force and COVID-19 Enforcement, Atta Hiharo. Now, you've just heard from the National Coordinator that the testing is still not enough. So, from this level, we know that FCT is not the epicenter of this pandemic in Nigeria, but we need to see a level of example from this Federal Capital Territory. What is being done to ensure that we have more tests on people?
Okay, yes, I think from the perspective of us within the FCTA as an administration going forward under Malam Mohamed Musa Bello and the Minister of State, Hajja Dr. Ramatu Tijani Aliyu, one thing we have preferred to do under their guidance is to ensure that we live positive within the context of our relationship with those at the PTF. That's the National Coordinator who is standing here, and the Chairman of the PTF and the SGF, Mr. Boss Mustafa. In the FCT, we try to be as extremely sincere as possible. That's why when persons ask questions, why is our number a bit high in recent days, we are proud to tell them that we are engaged in the fight, having been properly guided by the PTF at the national level here. We are testing and testing accurately, and at all times we are not dropping testing, because there is no need pretending, because COVID-19, from what we believe, is COVID-19 is real, it's very real. We don't live in disbelief, and we don't believe that the curve can be flattened by reduction in testing. We believe that the curve can be flattened if we get all those who are infected and we test them and actually help them get treatment and somewhat get them isolated and get them to come out of COVID-19. So that is what we are doing within the FCT to ensure that we are true to ourselves and true to what we are going through. And in that, we'll fight it and fight it all hard. And from the enforcement part, I think everyone will testify to that we are working around the clock to ensure that we do everything to comply and ensure that residents of the city are actually in tune with the directive and the guidelines given by the PTF at the national level.
All right, in your efforts, how are you seeing the compliance level from the people within FCT? Are they coming out where you make the facility available? Quickly.
No, I think people are coming out. They're coming out very much, very, very, very much, and we encourage, and we are very, very well. We are very happy about that. People are coming out. The testing centers are largely overstretched, and we are happy about that. That the centers available are overstretched because of the fact that when people come out, we encourage them. Although, as I have discussed with some persons from the Health Secretariat, we've wanted to have our test result coming out very quickly so that we can know the particular day, because sometimes, to be very candid with you, some of the results we are saying for some days, maybe the samples taken 3 or 4 days ago. So if we can get the result quickly, but whatever it is, it's a pandemic here and you cannot get it the way you expect it here. People are coming out and we are encouraging persons to come out here, and many persons around, particularly in high-brow areas like Maitama, like Asukuru, like Wuse, like Mabushi, which I believe are the leading areas for these within the FCT. People come out very much, and when people are symptomatic, when they are symptomatic, they come out to check. And as I told some persons in neighboring states, let's not believe we can feel that COVID-19 is not existing around. And when you show symptoms, you want to pretend, you want to go get bitter cola and others, that is deceptive. Go for tests and ensure you get treatment.
Thank you very much, Mr. Hiharo. Now, Dr. Aliyu, an assessment of the current phase has revealed that non-compliance, disbelief, or you call it denial, and the harsh economic impact of the pandemic have combined to temper the effectiveness of measures put in place in slowing down the spread of the virus. Now, what are the key additional efforts expected to slow the virus in the next phase?
We realized quite a while ago that one of the key interventions that we really need to continue to push on is the issue of effective risk communication and engagement of the communities. Informing people, telling them what COVID is about, getting them to your side, convincing them that this is a health crisis, convincing them that this is a risk to themselves. Now, the reason why COVID is not, a lot of people don't really take it serious, is because it's not acting like a normal pandemic. If you have Ebola, you'll have people bleeding and dying. If you have a serious crisis, a civil strife, you'll have people being killed on the streets, etc. If you have smallpox, for instance, people die from smallpox in large numbers, whereas with COVID, it's affecting mostly the elderly and those that are vulnerable. And if you look at the proportion of our population, only about 3% of Nigerians are above the age of 65. Whereas in Italy, it's 21%, in the UK, it's 18%. So if you have an infection like COVID, it will be very clear in those countries that have a large number of elderly people, because they will die in huge numbers. Whereas in Nigeria, what's our average lifespan is 57, 58. So the message we want to put out is, yes, if you are young, yes, if you are relatively healthy, if you catch COVID, you will probably be okay 90% of the time. But you could carry that COVID to your elderly parents, you can carry it to your loved ones, your family, etc. And that could be the end of them. And that's why it's so important to protect yourself and not allow yourself to catch this infection. The other thing that we are really doing at the moment is we are engaging with the state governments to push through the message right down to the grassroots, mobilizing the grassroots, talking to people right down to the ward level, getting the religious leaders, getting the community leaders to be on our side. Because if I come out, Musbao, and I say to you, you've got to wear your mask, you're less likely to believe me or do what I want compared to maybe your imam or your pastor or your village head. You're more likely to believe them because these are the people that you live with from day to day. And in the same way, we've put through our education messages right down to Keke Napep, people working within the Road Transport Workers Union, for instance, market women, etc. And if we can change our culture, because it's all about behavioral change our culture, make wearing of face masks something that is fashionable, something that shows how much you care about others. Because if I put a face mask today and I go out, what I'm saying is, I don't want you to catch COVID. I care about your health. I care about your well-being.
Exactly.
Yeah. So that's the message that we are trying to put out. So effective risk communication, a lot of community engagement, mobilizing the grassroots, making sure that the states and right down to the ward levels, all the whole leadership side is engaged and convinced that we need to do something to stop this pandemic from killing our loved ones.
All right, Dr. Ali, we hear about the non-pharmaceutical interventions towards mitigating the spread of the virus. So what does this imply?
So what are those non-pharmaceutical interventions? As I said, it's all about making sure that you put a physical barrier between yourself and the next person. With COVID, it's a respiratory viral infection. So if I cough or I sneeze, the virus escapes from me and it goes into the next person. If you want to stop a pandemic, for instance, if I stay in my home and I cough, I can cough till the next year. But if I'm staying at home and I don't have anybody else with me, that person will not catch it. So that means at the end of the day, that infection in me, if I'm a figure of 1, will become 0. So if you translate that to thousands and thousands of people, put in those physical barriers. And those physical barriers could be a mask. It could be maintaining a physical distance between you and the next person. It could be avoiding crowds. It could be putting face shields together with a face mask. It could be washing your hands regularly. These are all physical barriers that stop the virus from getting onto your mouth or your nose or your eyes, because that's where you catch COVID. You will not catch COVID from the infection touching your clothes. It's very unlikely unless you touch your face. So these non-pharmaceutical interventions have been shown consistently. If you do them combined as what we call a bundle consistently, you wear a mask consistently, you avoid crowds consistently, you make sure that you sanitize your hands all the time, you are aware of your surroundings. If somebody approaches you who does not have a mask, you keep your distance from them, because I don't even talk to people who do not have a mask. Musbao, you're a bit lucky. You don't have a mask and I'm still talking to you today. But,
you don't have to,
but that's because we are maintaining a physical distance. Exactly.
Exactly. That's what we're trying to do.
But I certainly would challenge anybody. I would challenge anybody out in the public who's not wearing a mask, because I know that it means that they don't really care whether I catch whatever they have.
Very well. Now, Mr. Hiyaro, now we don't really want any second wave in this pandemic, like the national coordinator just said. Now, what are the difficulties you're facing within the FCT to ensure compliance, and how do you want to go about it to ensure that the falling number of COVID-19 in the country and within the FCT will not rise again?
Well, I think the first thing we need to do as a people first is to tell ourselves very basic truth here. I agree with the national coordinator and the PTF and those are from the medical profession. I'm not a doctor, but I believe very strongly that COVID exists, that COVID is real. And I go out there to tell persons that, look, COVID is real and we must be very, very careful about it. At the initial stage, there is this firm belief, this firm fear and panic across the people from the pictures and the videos we saw coming out that came out from Wuhan, from the US, from Germany and others here. But at a certain point here, we got to a point where we started growing in very fundamental disbelief and what I term deceit from some quarters that COVID-19 is not real. The first thing we need to do going forward is to regenerate our mind and reorient ourselves that COVID-19 is real. And once we have a change of perception, we can do more by the way we behave and conduct ourselves. That's the first one. The second one that we also need to do is that all of us must become agents of communication. Like what Dr. raised, I keep on referring to those at the national level because most times it's not easy to be on set with them because we see them largely on television, but now I'm privileged to be with him on the largest network in Africa. But one thing very fundamental here, when we go out, our major challenge is the issue of getting people to start to act in a way that they just believe that they only act properly when they see members of the task force. One of the Sunday morning or Sunday and Monday, we went out, we saw people without face masks. Before we could even come down from the car, everyone was putting on face masks. That means they all have this face mask in their pockets, in their handbags and everywhere. The moment they sight the task force, they quickly, hurriedly put them on. That shouldn't be the way. Face mask is not seatbelt that you drag when you see a road safety official. No, you must put it on constantly to stay safe at all time. And one other point we need to understand, which I think is very critical. I have observed that in offices. When we go to offices, we feel that no one around our families, our office space, actually carry COVID. So once you get to office, the first thing you do as you drop your bag is to take off your face mask. That is fundamentally very wrong here. You must keep yourself safe throughout the period here. And the other one as well are those persons who are trying to be very heady, those persons who still open nightclubs in the FCT. We have been going after them very strongly. We have been shutting down nightclubs, shutting down beer parlors, shutting down very offensive gathering here, and constantly, even schools that are open. We went around schools yesterday, we saw about 90% compliance, and in 2 of the schools, we were accurately very disappointed, and we gave them very stern warning that should we come back again, the FCT authorities would not hesitate to shut down those schools because one, the student must write their exam, but they must stay safe to write their exams.
Exactly. But I can assure you that what you just said is not being practiced in NTA. We all comply with the protocols. And now let me come to the national coordinator. Some times ago, the PTF identified some high burden local government areas of the country with the virus. Considering this, how can the engagement of communities and local authorities be strengthened in driving campaigns? Very quickly.
So yes, we have 11 local government areas that we identified about a month or 2 ago in 4 states, Lagos, Ogun, Rivers and Bayelsa. And these 11 local governments are responsible for a large part of the burden of infection that we currently have in the country. We're now in the process of revising those local governments because we feel that the figures have changed and it's quite possible we'll have more than 11. So for these 11 local governments, we have been working very closely with the state governments as well as the local authorities to push through messaging. A lot of our risk communication work has gone into these 11 local governments. We are also in the process of setting up sample collection centers. I know they've gone very far in Lagos to have sample collection centers for the local governments. We have also started a process of training healthcare workers living within these local governments that are providing those services to make sure that they have enough PPE and are also educated and trained on how to use the PPE.
That's quite well. But before I let you go quickly, the aviation industry is to commence a process of reopening of international airports. How ready are we and how safe is this for now?
Yes, so it's the reason why we have the current delay, because we want to make sure that when we open the airport to international travel, we do it in a very safe manner. And as I said earlier on, there's a need to put up infrastructure to further make sure that those people that are coming into the country are properly investigated, they are properly monitored, they are properly screened before they come in. At this stage, we still have a lot of community transmission in country. So really, the number of the risk of bringing in people that would affect our burden of disease is really very limited. We will try whatever we can to mitigate the risk. The Honorable Minister of Aviation already has worked very hard to get the domestic part of air travel up and going, and we're very keen, as he said earlier on at the meeting we had a few days ago. We're talking about weeks before we open the international route, not months, and hopefully it will be fairly soon.
All right, so we hope that all of that will be done to just avoid the second wave that people are not actually expecting. It has been Nigeria today, and this is where we draw the curtain on this edition. And before we go, we must say thank you to the National Coordinator of Presidential Task Force on COVID-19, Dr. Sani Aliyu, for coming, for your time and perspective on the show.
Thank you for having me.
Also, the Chairman, FCT Ministerial Task Force and COVID-19 Enforcement at Iharo. Thanks a lot for your time.
Thank you very much, Musubao. And I want to appeal that we should join hands together with the PTF, believing that together we can defeat COVID-19.
Very well. And thank you, too, for being part of the program. You can watch these or other editions on YouTube. The address is youtube.com/NTA News 24 Hub. I am Musbat and Wahab. Stay well.